Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. And with the holiday season, people may feel tired and worn down after all the festivities are over. And those are symptoms common to fibromyalgia. It's something that affects 1 to 3% of the United States population. Approximately the same percentage of the population is affected by chronic fatigue as well, which is a closely related disease. Up to 18 million adults in any given year report these symptoms, making them a substantial public health problem. Women seem to be more affected than men. The fibromyalgia patient typically complains of widespread pain affecting the muscles as well as their tendons and ligaments. And scientific studies have shown decreased voluntary muscle strength and endurance in patients with fibromyalgia. One study demonstrated a 35% reduction in muscle strength among patients with fibromyalgia. And this loss of strength could be one cause of the disease or a secondary effect due to inactivity. Osteoporotic patients with fibromyalgia have impairment in strength of lumbar and abdominal muscles and also in measurement of chest expansion, which affects their breathing. There are also several studies that show benefits of pain reduction and improved aerobic capacity when fibromyalgia patients begin a moderate exercise program. In general, patients are more successful, that is, if they stick with it, with low-intensity exercises as opposed to high-intensity programs. A good exercise to start with is a simple walking routine. Even if pain occurs during the activity, the patient should be encouraged to continue. Inactivity and pain avoidance behavior is likely to increase symptoms even further. Common fears include activity will cause more pain, pain with activity means further damage, or that discomfort is a symptom of serious disease. If symptoms increase substantially with exercise, then a patient should back off a bit of the intensity and do a more gradual approach. As a patient's pain levels are reduced, they typically experience improvements in their psychological well-being as well. Heavy resistance exercise has also been shown to affect fibromyalgia symptoms. In one study, 13 elderly women performed a heavy resistance fatiguing protocol, and before and after a 21-week strength training period, and the strength training led to large increases in maximal force and continued to the improvement in loading performance. And the increased strength also seemed to reduce pain in the muscles. So these studies indicate that inactivity is often a big problem in fibromyalgia and chronic fatigue. Getting up, moving, walking, and even strength training at the gym can have potentially positive impacts on your pain. So this, coupled with chiropractic, is the best way to get over your post-holiday doldrums and feelings of pain and weakness. Have a healthy day.